There's something called as range of movements. You cannot translate, no problem.
一组运动。
I use these two categories of exercises. Very easy. Even if you don't know any asanas, no muscles, no joints, anything, you can help around the neck, back and knees by designing your own techniques based on the simplest idea. Idea is movement of the joint upwards, downwards, right and left, clockwise, anti-clockwise.
Well, give some example. What are the moves?
So starting from the simplest, smallest finger till the biggest joint. And so I will use this big up and down. I am using this joint, metacarpal. Up and down is one range of movement. Right and left, second movement. Rotation, third movement. Change the direction, fourth movement. Is it okay? So apply this simplest idea on all the joints. Is your therapy is done, designed, finished, class is finished.
We all can all do your job.
Huh?
We all can do your job.
Yeah. So each level, each fingers, if somebody is elderly and arthritis and very old age where they cannot do much of this biting, sitting exercises, can be simplest possible exercise you can give is each finger movement, up and down, right and left, change the direction, maybe some 30 times, each joint, second joint, third joint, and then all together, all the fingers, up and down, then right and left, change the direction, then at the level of this, up and down. If somebody can come and I can demonstrate.
Oh, let me just translate the word. 就是老师刚才说那个，就是动作方式，任何一个关节都可以动，从最小的到最大的，上下这是第一组，左右第二组，顺时针第三组，逆时针第四组。比如说你的妈妈或者是可能你的爷爷奶奶其实躺在床上是不能动的，他都可以去做这个运动，或者你帮他做这个运动。从身体的每一个关节，我们一根手指做完了，做第二根手指，再做所有的手指，然后可以再做到这个腕关节、肘关节、肩关节，全身都可以这样做运动。这个就是老师让大家工作的。
So this I already shown. At the level of elbow, for each joint there is a different range of movements. For elbow, you can see flexion is possible. I can flex. I cannot extend. So each level of the body has a different range. So we only move with a simple range. Left, right is not much. Here I can do more. Here I cannot. So each joint has its own range of movements. We need to know that and then do the exercises around. And if you don't know, but your body tells you, the body will not make you.
每个关节的这个灵活度不一样，所以你自己不知道哪没有关系，就是不要推到自己的极限之外。
And around the shoulders, back, front, back, front. Funny exercise, but it helps for sure 100%. And rotation. They are already designed different techniques for each joints. Did you? Sitting down, I will teach you some exercises for the leg. Others can stand up. I want you to sit. For sitting, same range of movement. Say for example, if he is able to do same each toes you are working up and down, right and left, clockwise, anti-clockwise. Imagine that I work with all this toe and now I could sitting like this, up and down, right and left, rotation, change the direction. You are going to do the same in a standing posture. Hold like this. 1, up and down angles, 2, 3, 4, 5, rotation. 1, 2, 3, 4, 5, rotation. I can hear it click, click. 1, 2, 3, 4, 5, change the direction. 1, 2, 3, no problem. 4, 5, stop. Do the same on opposite. And come. Right and left. 1, 2, 3, 4, 5, rotation. 1, 2, 3, 4, 5, change the direction. 1, 2, 3, 4, 5, stop the practice. There are 3 groups of muscles: skeletal, cardiac, smooth. The muscles on the skeleton called as skeletal muscles. The skeletal muscles. Heart muscles are different set of muscles. Cardiac. In our stomach and other areas there are smooth muscles.
有3种不同的肌肉，一个是在骨头上的，叫什么骨骼肌，然后一个是心脏的心肌，然后另外一种就是在我们那些内脏其他部分那些平滑肌。
So all exercises we are designing is around the skeletal muscle. So second exercise for the knee, in his sitting posture I will show you. Holding like this. Gentle movement, because he is already having knee pain also. Up and down, gentle one. Right and left. You are going to do standing with rotation.
The person asking that you is standing.
Same direction, same what she is doing.
You want to do something.
Yeah, hold.
老师刚才说我们现在做的这些全部都是骨骼肌的相关运动。
2, 3, 4, 5. Right and left. 1, 2, 3, 4, 5. Rotation. 1, 2, 3, 4, 5. Change the direction. 1, 2, 3, 4, 5. Slowly drop it down. It looks funny, but it is loosening all the small joints, which is very essential. When small joints are getting loose, body gets a more signal that it is a phase of relaxation. Bigger muscles also getting loose automatically. You are creating a biorhythm. Body's rhythm to relax will increase. Sorry. This one. Right and left. Keep doing. Change. So the practice. One more last moment I will show you and then I will tell you something. Notice in your one side of your hip joint there is something else happening. Another side of your hip joint something else is going to happen in this next exercise. Hold your hands on your hip. For him, for you, I'll tell for them and then we'll come back to you. So hold like this. Keep your body weight on one leg.
单脚站立。
Same range is same. Up, down, right, left, clockwise, anti-clockwise. So move 1. It's like this 5 counts. 2 is like this 5 counts. You keep doing. 3 is like this. 4th one is like this. Keep doing without dropping your leg down. See what's happening. One leg you are moving. It will not be paining. Other leg you are not moving. That will be paining. This one you are going to bring one leg. Arm straight. Center. Left. Center. Right. It works on the joint. Right. Center. On one side and same on other side. You are able to feel the hip joint? You are able to feel the hip joint?
Yeah.
Okay, keep going. What was the observation? What was the observation?
The other side also moves. The other side of the hip also moves.
It moves, yes, definitely. When you are doing this, you are doing a range of movements on one side and the other side body is holding the entire body weight on one leg. So that leg is also working in other way. One leg is working in one way. Okay? So those are two exercises. Sit down. Don't get scared. Don't scare me. I'm a bit scared. See what set of exercise we have done is, one is the range of movement. Next I'll be teaching you resistance. There are one more set called as active and passive.
主动的和被动的练习。
Active means you move. You move your index finger up as much as possible. Move up and down. Is active movement.
这是主动的练习。
Passive is the one which somebody else moves.
这个是被
You
动
can
的
move
练习。
more. Get it? So there is a more stretch response, stretch reflex when you do passively. Somebody else does for you. Or you move your joint little extended than a normal range. Normal is only this much. I can up some angle, down some angle. So that is normal range of movement. So passive is one which I can extend more, stretch more.
被动的练习我们通常可以玩的更多。
So exercises are divided into active exercises, passive exercises. For back pain, both active and passive exercises will help.
腰椎的纠正练习，主动和被动都是必要的。
One more exercise, that is isometric. Will be tense now. Isotonic. Agonist. Antagonist.
What is ISO?
Gravity. Anti-gravity. Very simple. Don't worry about this technical terms. In one of the exercises, muscle length will reduce and then muscle contract. So I am lifting a weight, my biceps are contracting. That kind of exercises are called as isotonic.
肌肉收缩的运动叫 isotonic。
Okay, one exercise, see that I am pushing this glass. My shoulder muscles are not shortening, but still it is working. Okay? So it is called as isometric, where the length of the muscles will not shorten. It will remain same, but still muscles are working.
另外一种就是我们推墙的时候，比如说这个肌肉的距离并没有变短，但是我们还是在工作，这是第一种。
When you are doing this movement, left side of your body is into isometric exercise. That's why it's paying more isometric. So left side of your body. When you are doing this, there is a range of movement. What can I tell you? Range of movement. Range. Okay. So at the back of your mind, you should be able to design techniques based on this knowledge for neck, back, knees. Finished. So agonists are the one which works in one direction. Say for example, I have to flex. So these muscles will work here. And opposite of the muscles are called as antagonist. For this to flex, this has to relax. Agree? But for this to flex, this muscles has to relax. So both work in a synchrony. So you have to focus on those groups of muscles. So the gravity, anti-gravity means when I am adopting some posture, there are some muscles which are pulling towards the gravity and some muscles which are pulling away from the gravity. When you are standing, front of your body towards the gravity. Back of your body, it is pulling against the gravity. So then you balance. Okay?
我们的肌肉都是成组运动的。当我们这边的肌肉在收缩的时候，这边肌肉就是在拉伸，这是一组。另外一组就是当我们这个肌肉是往下运动的时候，会有另外一组肌肉往上运动，我们才能保持平衡，就是作用力与反作用力。
We'll stop at this. Right? Your back of your neck. Sorry, the back of your head. Neck. So drawing I could not draw properly. Back of your head, your upper back, hip and heels. Posture of the body very important. I'll use the simplest possible chart to adopt a proper posture. To practice this, I'll use this wall.
老师让我们解释一下怎么样是正确的站姿。
I touch my heels to the wall.
脚后跟贴墙，
Back of my hip, we'll call dimple of buttocks. I'll touch. My upper back will touch
屁
and
股
my
贴
head.
墙，然后肩胛骨贴墙。
In this position, if I can balance those 3 points, base of the big toe, base of the little toe and base of the heels. And now balance your body weight in a such a way that you are putting equal points on each of this point. Base of the big toe, 1 point, put a equal pressure, equal weight. Base of the little, equal weight. Base of the heel, equal weight. This could be a perfect anatomical posture of the body to correct alignment of the spine, of the shoulders, shoulder blades, and of entire standing gesture. So this way we'll walk for about few steps like this with this alignment. So usually what we do is in a yoga teachers, we will making the stand and we will tilt pelvis and we will correct in off wall posture. So it will be easy when the teacher is doing it, but when you go back home, you will be forgetting what to do. Correct? When teacher is there, he will be able to help you. That's why they say importance of teacher is that when you are student of any yoga center and teacher is teaching you, there will be something more learning beyond just the logical. So there will be touch and feel, and you will be able to correct in presence of a teacher who knows something. So practice this, come.
我们那个脊椎不正直，很多原因是因为我们的站姿不对，所以老师刚刚跟我们介绍这一个后背的3点全部贴墙，然后在这个同时要保证大拇指的下面、小拇指的下面和脚后跟都贴墙。我不知道大家有没有这个问题，很多人的这个骨头都不是水平的，然后自己有的时候不知道什么样的位置是正的，这就是让老师帮我们看一下，帮我们调整。
You can do it here. Don't get scared. Yesterday you are very comfortable because you are not doing anything. Today you have to do double one body movement and brain movement. So stand like that. You push his legs, push it slightly.
想象脚心的3个点。
The heels back, and your foot is slightly up. Arms out and is it comfortable for you? Comfortable? Okay.
可以吗？舒服吗？
Palms up, hands up, relax. Being aware of your body weight on the 6 points. Put your body weight equally on those. That itself is a correction. Even if you forget these 4 points, no problem. Putting equal weight on this 6 is a balancing technique.
想象脚心的那6个点，把它中央。脚后跟要不要并是吗？ The heels should be closed or separate.
Depends. You want to close like this, no problem. You want to separate, no problem. But equal weight on all the same. 3 points on right, 3 points on the left.
脚后跟可以并可以不并，但是要保证
With this
平均。
awareness, you walk a bit. With this awareness, like
the 6 points walk.
想象这6点，然后我们走一走。
make your mind walk. You walk with the point that you are putting equal pressure on each
尽量保持
of the
这
points.
6点还是平均的，承受你身体的重量。
Walking meditation.
机器人啊！走一会儿就忘了。
其实我还好，平常弯的厉害。没有，你就是表示你平常弯的厉
自己往里跳起来。The whole weight of the body in 6 points.
但其实头其实有一个，自然就对，自然就好。
So normally your skeletal structure is not in this.
走一走
You
路。
have palms. That's Yes.
就是一个肌肉，它向上往回，就是你说一个是收紧的时候，一个是放松，它就是一个是拮抗肌，一个是什么肌，它是一组一组的。
另外那个
It's not usually the muscles.
没有，它是这样的，就是肌肉收缩的时候，比如说我这样子，肌肉是收缩的，对，这样子的话肌肉是收缩的。但是你如果是我是拎了个东西，手上拿了个很重的东西，我其实这样是打开的，但它其实也是在收缩。这个是离心收缩，然后这个是向上收缩。对，但我不知道他说的是不是这个概念。
Any questions till now? How about this walking? This is supposed to be when you there's a do you know are you aware of walking meditation? First key point is this: shifting your body weight equally on both the legs.
行禅，刚才主要说行禅最重要的第一步就是我们要把这个重心平摊到脚的平面上面。
So earlier when we walk with the hands,